Welcome to the 10-minute series of videos related to competency-based programs. My name is Madeleine Bazurgi from the Office of Academic Development at Dawson College, and I'm pleased to present what is competency. Let me ask you this. What makes a competent medical diagnostician? What does your GP have to know to be able to do to make a good diagnosis? I'll let you pause the video to jot down some of your ideas, and we'll compare notes. To be a good diagnostician, the doctor must have knowledge and expertise in their field, such as anatomy, pathology, symptom presentation, and types of medical tests, and of course, a lot more. They must also be skilled at listening and communicating. A doctor who listens carefully to a patient's history and concerns and communicates clearly and effectively is more likely to gather the necessary information to make an accurate diagnosis. They must have good judgment and critical thinking. A doctor who's able to analyze information from multiple sources and weigh the potential risks and benefits of different diagnostic tests and treatments is more likely to make the correct diagnosis. The doctor must also have the following attitudes. A doctor who's open-minded and willing to consider a wide range of possibilities, including rare or unusual diagnosis, and is collaborative, willing to consult with other healthcare professionals such as specialists or diagnostic imaging experts when necessary, is more likely to make an accurate diagnosis. And finally, they need to have lots of clinical experience. A doctor with years of experience in diagnosing patients is more likely to recognize patterns of symptoms and signs associated with various conditions. A good medical education contributes to developing a doctor's competency to make a diagnosis. Of course, at the start of their career, they will not have as much clinical experience, but an education program that gives them a lot of opportunity to practice will make a better diagnostician upon graduation. The education provides the opportunity for a doctor to know how to do, and to be. The competency is the ability of a doctor to apply or integrate learning, to mobilize the knowledge, skills, and attitudes to solve a complex problem like diagnosing a medical condition. If you wrote that a doctor who excels at diagnosis needs a combination of skills, experience, knowledge, judgment, as well as the ability to approach each patient with an open mind and collaborate with other professionals, you have described competency. This is my favorite definition of competency. A competency is an ability to perform a complex task or solve a complex problem based on the effective mobilization and combination of a variety of internal and external resources within a family of situations. Let's first take a look at what is meant by internal and external resources. What is meant by solving a problem or performing a complex task using internal resources? You will probably recognize the following graphic from another video. The internal resources mobilized to solve a problem or perform a task are the knowledge, skills, and attitudes a person acquires or develops. These may be self-taught, learned in your class, or from life experiences. In the knowledge category, there are the facts, concepts, theories, principles, models, etc. The content of your course contributes to students acquiring these. Other mobilized resources are the skills. These consist of procedures, techniques, and methods, as well as metacognitive processes, critical thinking, problem-solving skills, etc. And we know that to develop these, you need a lot of practice. So in your class, practice helps students develop these. A third contributor to the exercise of competency, as we've seen in the case of a good diagnostician, is attitude. The attitudes are the ethics, morals, and values appropriate to the exercise of the competency in the occupation or in the pursuit of studies. And your valuable feedback helps students develop the proper attitudes. Now think about how you exercise your own competency of teaching. You don't just rely on your internal resources, your knowledge, your skill, and your attitude. You may also reach out to other sources of information from peers, other teachers, experts, and other information resources, documents, books, scholarly articles, the internet, etc. Competency develops over time, and true mastery may take up to 30 years. Now that we've looked at the internal and external resources that are mobilized to solve a complex problem or perform a complex task, let's take a look at what this means within a family of situations. Developing competency takes time and practice. Practice solving problems, practice analyzing something, practice accomplishing a task. A competent person is not only able to solve a given problem or perform a single task, but is able to transfer knowledge, skills, and attitudes to new situations within the same family. An effective course or program gives students many opportunities to exercise competency at different levels and in different situations. For example, giving an injection to a newborn in a neonatal ICU, or a vaccine, or even Botox. And how about in a situation where, a patient is afraid of needles? A competent nurse is able to respond to a variety of new situations in the occupation. As educators in a competency-based program, we may simulate a variety of situations to better prepare the student for the workforce or for university studies, and hope that they are able to transfer the knowledge, skills, and attitudes they've acquired to new situations. Here's another example of a family of situations for a physiotech course. In this course, as in the occupations, students will help a client with their shoulder and their forearm. As an educator, I will ensure they learn the techniques and have sound knowledge of anatomy and physiology. I will have the students repeat the techniques with different patients in different situations. For example, with a patient with an athletic injury, an injury from an accident, or somebody coming out from the hospital. By the end of the program, I hope that they can transfer the knowledge, skills, and attitudes to other cases, such as a patient coming out of surgery or a shoulder dislocation, scenarios we may not normally encounter in the classroom. Competency is the ability to solve complex problems, perform complex tasks in a family of situations. Although the learning objectives in your classes are met by students demonstrating their knowledge, skills, and attitudes, probably in formative assessments, the competency itself is greater than the sum of its parts because it involves being able to analyze, evaluate, or create something based on that foundation of knowledge, skill, and attitude, and then to be able to transfer those to a new situation. Those of you in design will know this as Gestalt, when an outcome is greater than the sum of its parts. The result of learning is not necessarily an immediate performance, but a long-term set of knowledge and skills that can extend or transfer to different contexts and different situations. Here's an example most of us can relate to. You're in your driving class 101. You will acquire some knowledge. You'll learn the rules of the road, the laws related to cell phone use, protocols such as the right of way, and the basic building blocks of a car. And you will develop skills such as merging onto traffic, changing lanes, passing, parallel parking, and U-turns. And for sure, you'll be watching your attitude, or your instructor will. You'll be practicing in a variety of conditions, on highways, in cities, on gravel roads, in the rain. You may even pass your written driver's test while continuing to practice. But your written test will not be enough to attest to your ability to drive. Rather, it will test your knowledge. If you're a competent driver, you'll be able to mobilize what you need to respond to different road situations, like driving in traffic, anticipating other people's moves, and making last-minute decisions. Even though you may not encounter every possible scenario when you are learning. By means of a summative assessment at the end of your driving lesson, an examiner could infer that you will be able to drive a car in the future if you pass a road test. That final examination requires you to integrate the knowledge and skills and attitudes you've developed and verifies your ability to respond to new situations. That exam verifies your ability to put it all together, the Gestalt. And that is the concept of assessing a person's competency. Teaching in competency-based programs means that we demand more from our students than simply repeating facts, concepts, and theories, or applying rules and techniques. In fact, that's what legacy programs were based on. They were based on the lower levels of Bloom's taxonomy. Rather than developing competency, students were required to recall, understand, and apply techniques. Competency-based programs, on the other hand, require more from our students to meet the needs of society. They require students to apply or integrate knowledge and skill to act at the higher level of Bloom's taxonomy, to analyze, evaluate, and to create. It's easy to relate to technical competencies like the ones nurses or electronic technicians must master. But what about pre-university competencies? How can we think of these as a person's ability to mobilize knowledge, skills, and attitudes in a family of situations? Well, competencies we develop in pre-university programs are meant to equip students for further studies, and so will require a person to act at the higher level of Bloom's taxonomy. In pre-university programs, students may need to acquire quite a bit of disciplinary knowledge to pursue university studies. And in our classes, we will deliver content and evaluate a student's ability to recall and understand that content, such as theory, concepts, facts, models, etc. But that's not enough to pursue university studies. In competency-based programs, we also intentionally develop and evaluate these. The ability to organize one's thoughts, how to summarize information, articulate ideas, how to plan and organize a project, how to research information, how to approach and solve a problem, and make meaningful links, and how to collaborate and interact with others, among many other skills. This is competency. In pre-university and in technical programs, competency is defined as an ability to act, to solve complex problems or perform complex tasks, and to respond to new situations with a solid foundation of knowledge, skills, and attitudes. Thank you very much, and stay tuned for the next presentation.